what it is an intention. You were talking about intent, and a knowing, and an absence of any thought that I can't do this. She was so determined and convinced that she was going to do this, that the energy to heal herself of something she'd had for almost 4 years was there. And to this day, her face is as clear and smooth as a child's could be.
So it's a very, very important point here, and I want to address this just from a medical point of view. You know, I trained as an internist and neuroendocrinologist at Harvard and BU and Tufts University in Boston, and I remember 20 years ago a patient walking into my office who'd just been to an oncologist with breast cancer, and she was devastated by the news because it was stage 4, and they talk about statistics and so on. And as soon as she walked in, I said, "Mrs. Smith, I have good news for you and I have bad news for you. The bad news is you have stage 4 cancer which has no cure. And the good news is I'm a quack. So maybe I can help you." I think everyone here has heard, and you should tell them about Marcy's.
Oh yes, I will. Yeah.
One, the thing to remember here is everyone's heard about the placebo response, right? You've heard about the placebo response, where if you sort of have the intention that this drug is going to help me, it creates a physiological response. In fact, in the last 10, 15 years, we know how that happens. If you think that this is a pain-relieving drug that you're taking, then as soon as you take it with that belief, your body generates endorphins and enkephalins that are more powerful than any heroin you can buy on the street to actually create that analgesic in your body. So the intent gets transformed into a molecule. Placebos work in ulcers and other things, etc. So every time that intent is introduced beyond the ego, it creates a biochemical response. That's what a placebo is. It comes from the Latin word, "I shall please." That's the origin of the word. What doctors don't know about is the nocebo response. The nocebo is the opposite of the placebo. You say, "Mrs. Smith, you've got stage 4 cancer, and the statistics show that in about 6 months, 90% of people will die from it." Now, as soon as she hears that, then she, of course, thinks she's in the 90% who are going to die. She doesn't think about the 10% who are not. And first of all, which something that we don't recognize, even as smart physicians don't recognize this, that statistics actually have nothing to do with prognosis in a patient. It's like saying the average temperature in San Diego for the year is 75 degrees, doesn't tell me what today's temperature is. Okay, if I say the average income in La Jolla is $100,000, it doesn't tell me what your income is. Statistics never apply to the individual patient. So you cannot prognosticate on statistics, but we do it all the time. We create the nocebo effect, and then we create that whole thing, Statistics, and this at the risk of being a sexist joke in medical school, at least one fellow told me this joke. He said, "Statistics is like a girl in a bikini. What she reveals is obvious, what she conceals is much more interesting." And you heard the other one? 9 out of 10 statistics are wrong.
Right. Including this one.
including this. So remember, nocebo, in Australia, they have a custom in the Aborigines. If you don't like somebody, you go to your Australian Aborigine sorcerer, is shaman, and witch doctor actually, and you say to this witch doctor, "I want to get rid of this person." So he takes this little stick, he does a ritual around it, mantras and Aborigine sounds and so on, and he tells you, "Okay, now you point that stick to your enemy." Within 24 hours of pointing the stick, the person starts to get nausea and vomiting. 3 days they are dehydrated, in 1 week they're dead. The Australian government actually outlawed the custom of pointing the stick amongst Aborigines as murder with a lethal weapon. So that's how powerful an idea is. It gets transformed into what is being prognosticated. So statistics should be totally ignored. That's message number 1. The message number 2 is don't put your attention on what you don't want.
Exactly.
If you're trying to get rid of this cancer, don't think of, I don't want to die. Think of how I want to live my life.
And be cautious about all of the places where you're going to run into the kind of information that will help you to put your attention on what you don't want. Because and that's called the energy field. So whatever field of energy that you are in, if you allow it to be contaminated by other people who are bringing you down, you will find yourself, buying into the very thing that you don't want to create for yourself. So it's like keeping your energy field really clear. That's why you don't share it. The doctor tells you, you've got 6 months to live. You don't tell anybody about that because people are starting to count the days. And where there's a will, there's a relative. They're going to... How Deepak and I became friends and colleagues was, it must be 10 years or more back now, that my wife I was in Seattle, and I got a call from her. I was doing a book tour in Seattle, and I got a call from her saying that she had a nodule on her thyroid, and that, it was the worst kind of prognostication, and I thought, that one of the doctors that she had been to said that she would have to have surgery immediately. She very likely had cancer. She was going to lose her throat. It was just, and I was devastated. I was going on Good Morning Seattle or something, and trying to catch my breath, and thinking my wife, who was in her 30s, is, And Deepak's work was just coming out at that time through Nightingale Conant and so on, and I think we were scheduled to appear together on a program in San Francisco, as a matter of fact. I called his office, and Marcy went to the center. At that time, it was in Lancaster, Massachusetts. And Deepak became her physician. She went through the whole Panchakarma treatment, and learned to meditate. And she had never meditated before. And when she learned this meditation process, and when she went through all of the various massages and all the lectures and the whole intense thing that they offer at the Chopra Center, today, she was told that she would have to be on thyroxine, an artificial thyroid supplement for the rest of her life. She doesn't take anything like that at all. Her thyroid is normal. And she's, been healed of that. And my friend, Dr. Chopra here, is someone that my wife believes saved her life. Yeah, it's a true story.